You know, for more than 20 years, many women who survive breast cancer can have all aspects of reconstruction covered under their insurance plan, as it should be.
Absolutely, that's right. Thanks to the U.S. Women's Health and Cancer Rights Act of 1998, many women can now have the shape of their breasts rebuilt right after cancer surgery through reconstruction. But you're about to meet a young West Coast mom who's sharing her own breast cancer story just so she can get the word out.
Melissa Patullo is a 43-year-old wife and mother of two from beautiful Vancouver, Washington.
I am married, and I've been married for 13 years, and I have 2 kids. I'm really into golf, and I enjoy working out when I have the time.
Like so many young moms, Melissa wanted to explore ways to enhance her post-pregnancy body. But when she went to discuss her options with her plastic surgeon, things took a very different turn.
So it was the beginning of May, and I had my consultation with Dr. Gabriel and ultimately scheduled my surgery. And I started feeling a little bit of pain in the right upper area of my breast. I did my diagnostic mammogram. That's when things went downhill. It was a couple weeks later that I had my biopsy and got my cancer diagnosis.
Every year, more than 200,000 women in the U.S. are diagnosed with breast cancer. Yet more awareness of the accessibility and benefits of breast reconstruction is still needed. Dr. Alan Gabriel has been one of the nation's leading breast reconstruction surgeons and advocates since the late 2000s.
When you look back 20 years, there have been important milestones in breast reconstruction. One, the insurance start covering it for patients. 2, we've learned that maybe not removing so much tissue from the breast during the mastectomy, meaning skin and nipple necessarily, is needed for us to cure the patient from cancer. And number 3 would be the advances in implant technology, surgical techniques, and more importantly, understanding what's better for the patient, such as under or over the muscle, has really changed the way we look at reconstruction today and has really given women more options.
For well over a decade, Dr. Gabriel has partnered with a leading breast implant maker, Natrelle.
I chose a double mastectomy. I had to total a year worth of chemo. When Dr. Gabriel and I first spoke about reconstruction, ultimately I knew 100% that I was going to do reconstruction, which is hard to think about at the time, because when you think I have breast cancer, I feel like you think, well, that's it, you know, there it goes. There goes my boobs. We discussed it, and he was really adamant about the fact that I could get what I wanted out of this.
Anytime a woman chooses to have breast implant surgery, there are risks that are associated with it. Natrelle breast implants are for breast reconstruction to replace breast tissue that was removed due to cancer or trauma, or that failed to develop properly due to severe breast abnormality, and for revision surgery to improve primary breast reconstruction. I personally have been using the Natrelle line of expander and implants for 14 years since I've been in practice. The first thing that the surgeon and the patient have to consider is placing the tissue expander. The Natrelle tissue expander has the advantage of being soft, where we can fold on itself and remove it and place it through small incisions, and also gives us an option of choosing implants that are 5 different projections and 3 different cohesivities. Both of you go through this journey. Now that we're done with the expander portion of the reconstruction journey, we start going through the process of the implant journey and selecting an implant with the help of the patient. With the Natrelle brand, we have 300 choices of smooth implants and 3 different versions of gumminess. We have gummy, gummier, and gummiest that are available for us surgeons and patients for us to be able to create final shape. So that makes it very unique for us as surgeons. It's also important to remember that you should not get breast implants if you currently have an active infection, untreated breast cancer or precancer, or are pregnant or nursing. Tell your doctor about any conditions you have, any medications you're taking, and any planned cancer treatments. Breast implantation is likely not a one-time surgery. Having implants removed and not replaced may lead to permanent cosmetic changes of the breasts. Breast implants may affect breastfeeding. Gel implants may rupture without symptoms, so periodic imaging after surgery is recommended. Key complications are reoperation, implant removal, implant rupture, implant deflation with saline-filled implants, and severe capsular contracture.
Many reconstruction patients are pleasantly surprised to discover they can have the look they always wanted even after cancer.
Did I want to look more natural? Did I want to look more full and perky, which is the way that I went.
But the breast cancer journey doesn't end at reconstruction.
We started the Pink Lemonade Project in 2010. I was telling my wife the issues that we were facing for our breast cancer patients. The simple answer was for us to start figuring out what can we do for patients for life after breast cancer. And since then, the community has stepped forward and really supported. This is why I continue working with Natrelle, because Natrelle has their own arm of advocacy, and it really supports previvors, survivors, and it's something that we all have to be thinking about.
I used to have really long hair. Now it's a little bit shorter, so I'm working through the grow out. But ultimately, I'm doing good, and I'm on the road to recovery. This is the part I can't say without crying. Both Mike and I feel this way, and I've said this to Dr. Gabriel, that it's, you know, just another work day for him and for his team. But for the patient, it's life-changing. It saved my life.
We want to thank Dr. Alan Gabriel and Melissa for sharing both their expertise and personal stories with us. To get more information on breast reconstruction, patient information, and how Natrelle supports the breast cancer community through Pink Ribbon Strong 365, go to natrelle.com.
And of course, you can also learn more information at our website, thebalancingact.com. Please stay tuned for some important safety information, including boxed warning. And we'll be back right after this.
Breast implants are not lifetime devices. The longer patients have them, the greater the chance they will develop complications which may require more surgery. Breast implants have been associated with a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. Some patients have died from BIA-ALCL. Patients have also reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. The use of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.